Let us continue our discussion now with the peritoneum topic, guys. Another very important topic in abdomen. And most of the time, what I have seen out of my experience of last 9 to 10 years of teaching, I'm telling you that most of the students will not have a proper orientation of this one. The problem is that you will be directly studying in your MBBS days regarding epiploic foramen and the boundaries of that, or else you'll be studying about the lesser sac and the relations of the lesser sac directly. But that is not the right approach to this topic of peritoneum, guys. You have to learn the topic of peritoneum starting from the embryology part. You should have an idea regarding the rotation of gut, and then from there on, if you learn about the formation of peritoneum, the concept will become like crystal clear. And not only that, it will be easy for us to even remember, guys. Okay, so let's start right from the embryology and then connect that with the gross anatomy part. So I'll just show you that picture later on, guys. Don't worry about that. First, let us make our simple pictures here, simple structures, and then later on, we'll actually see that atlas diagram also. So I hope you people have gone through the videos of embryology where I taught about the rotation of gut, that is foregut, midgut, and hindgut development and the rotation of that. Now, when you study about the foregut, for example, if you are taking a transverse section, imagine this one to be the outer body wall ectoderm, and this one is the inner body wall endoderm. Endoderm is the one which is actually going to form your gut. And this time, for example, we are taking the transverse section at the level of stomach. So we are taking the transverse section at the level of foregut, that too at the level of stomach. So outer ectoderm, inner endoderm. Ectoderm is the one which is going to form your body wall. Endoderm is the one which is going to form your gut. Now, what about the mesoderm in the middle? That is the one which is going to form your peritoneum, sir. So the peritoneum, which is actually covering the organs, visceral peritoneum, and the one which is present on the outer side here, that will be the parietal peritoneum. And these two will be connected by a double layer of peritoneum, which is referred to as mesentery. So there will be a double layer of peritoneum, which is known as mesentery there. Obviously, there will be a ventral and dorsal mesentery. See, mesentery is actually a general word, but because it is now related to stomach there, it is the one which is actually connected. The double layer of peritoneum is connecting with the stomach there in the middle. So more specifically, we should call it as mesogastrium. Gastrium, stomach, mesogastrium. So there will be ventral mesogastrium and there will be a dorsal mesogastrium. Now, liver will be actually developing in the ventral mesogastrium here, whereas the spleen will be actually forming in the dorsal mesogastrium here. That itself is an important question. Spleen develops from the dorsal mesentery, dorsal mesogastrium. Understanding? The liver is forming in the ventral mesentery and the spleen is actually forming in the dorsal mesentery. Now, my dear doctors, as a medical student, I'm a little bit confused. When you compare the embryology, this diagram, with the gross anatomy, it's not correlating. Why? Why? Because I am telling you here that liver is actually forming in the ventral mesentery. That means it should be in the front, but my liver is absolutely not at all in the front here. And spleen, I am telling it is forming in the dorsal mesentery there. But do we have spleen behind? No, spleen is not behind. Then what is happening here? Yes, the foregut is actually rotating. I'll just show you here. Try to understand with this. For example, you just imagine this one to be your foregut here. Now, if this one here will be the foregut, if this is the foregut over here, guys, yes, the liver will be actually developing in front here, whereas the spleen will be forming behind. Okay, for example, if this is the stomach, we have actually drawn this diagram on the screen here in transverse section. So once you draw the diagram in the transverse section and we are looking from above here. So imagine this is the gut and we are at the level of stomach. And right in front of the stomach, there is a formation of liver here and behind there is a spleen. But do we have liver exactly in the front? No. Then what is happening here? Now this foregut is actually rotating and that is rotating 90 degrees in clockwise direction. 90 degrees and that too in clockwise direction. So because of that clockwise rotation, that to 90 degrees, what is going to happen? The liver in the front will be coming towards the right. Liver in the front will be coming towards the right and the spleen behind will be going towards the left here. So liver will be coming towards the right and the spleen will be going towards the left because of this clockwise 90 degrees rotation. This explains the condition very clearly. Now observe your body and my body. Yes, of course, liver is towards the right side, whereas the spleen will be more towards the left. So from here we understand that Foregut will rotate 90 degrees in clockwise direction. Now, that is the place from where we have to actually begin to understand about the peritoneum, guys. Okay, so that's your foregut, and foregut it is rotating 90 degrees in clockwise direction. And after rotation, now let us compare this embryology with the gross anatomy. So let's draw the diagram of the transverse section of the abdomen in the gross anatomy. That means right now like your body and my body here. So imagine this one to be the abdominal wall, the posterior abdominal wall and the anterior abdominal wall. And where is the liver, guys? The liver will be actually towards right here. And in the middle here, imagine this one to be your stomach. Perfect. And the spleen will be a bit towards left here. So after rotation, this is the scenario right now. So liver will be towards the right, the spleen will be going towards the left, and the stomach there in the middle. Now once you are comfortable and you have understood the arrangement of these structures over here, then what about the peritoneum here? Now this here will be the parietal peritoneum, guys. Let us trace the peritoneum. That's your parietal peritoneum towards the outer side, or we can say attached to the body wall, that is abdominal wall. And now this parietal peritoneum will reflect here, and then it is the one which is going to enclose the spleen here, then further reflecting, enclosing the stomach here. And then, my dear friends, remember, this will be actually moving in this manner. Don't try to attach that to the liver, I'll tell you the reason why. And then further the visceral peritoneum coming here, and is again going back and continuing as parietal peritoneum. Let me just finish the diagram and then I'll tell you about the names of all these peritoneal folds here. So this is the parietal peritoneum here, and then it will also reflect onto the liver, guys, enclosing the liver. So even liver is completely enclosed by the peritoneum there, and that is the reason why, remember, even liver is also like intraperitoneal organ. Perfect. So that's the tracing of the entire peritoneum here, guys. Now once you are comfortable by tracing all this peritoneum here, the parietal peritoneum, visceral peritoneum, and the peritoneal folds or the mesentery connecting them, let us now give the names to all these structures now. First of all, let's finish off with a simple one. What is the name of this ligament here, guys? Obviously that is between the spleen and behind posterior abdominal wall, there you have your kidneys. So therefore this ligament here is referred to as the splenorenal ligament. That is splenorenal ligament, or else it is also known as the lenorenal ligament. Perfect. So splenorenal ligament or spleen is also referred to as lenorenal ligament. Now what is the content of this one? That's important. Remember, the artery which will be supplying the blood to the spleen will be passing from here only. That is your splenic artery. So this ligament is the one which will be actually having the splenic artery. And not only the splenic artery, remember, even the tail of the pancreas. Tail of pancreas will also be present in the splenorenal ligament. And in the abdomen topic, from the very beginning, we have drawn a lot of times the pancreas, the head, neck, body, and tail, and finally the tail will be lying in the spleen. And remember, in the spleen, it will be in the splenorenal ligament. Perfectly done. Now the next one here, what is the name of this ligament, guys? I think this is the easiest one. Between the stomach and the spleen, it has to be gastrosplenic ligament only. This is gastrosplenic ligament. Now again the same thing, we got to learn like what is the content of this gastrosplenic ligament. It will consist of what? Now try to understand that is actually like towards the greater curvature of the stomach. Lesser curvature of the stomach is towards the liver. So we have got the stomach here and the liver here. Yes, lesser curvature, lesser momentum between the stomach and the liver here. But whereas on the other side we'll be actually having the greater momentum side, the greater curvature. So because that is actually the greater curvature, we all know very well towards the greater curvature of the stomach, you'll be actually having gastroepiploic arteries present over there. And a little bit near the fundus walla part, you'll be actually even having the short gastric arteries. So those will be actually located in the gastrosplenic ligament. So gastrosplenic ligament will consist of left gastroepiploic artery, And not only that, even the short gastric arteries. Short gastric arteries. So left gastroepiploic artery and the short gastric arteries will be the content of gastrosplenic ligament. Now, once you are comfortable with these two are like simple things. These two are done. Now, let us move towards the other side. On the other side, liver. In between the liver and the anterior abdominal wall, I'm able to appreciate one ligament here. Now, what is this ligament? Guys, try to recall this ligament. We have seen like thousands and thousands of time. Whenever you study or whenever you see the picture of liver, right in the front on the anterior surface of the liver, there will be a ligament. And that ligament is nothing but falciform ligament. That is falciform ligament, sir. Right in front of the liver, you'll be actually having falciform ligament. And now, what is the content of this falciform ligament? Remember, that's the one which will consist of ligamentum teres in that. So, when you observe the diagram of that very carefully, falciform ligament in the lower border of that, okay, it will consist of a ligament. That ligament is nothing but ligamentum teres. That's the content of that. So, till here it is simple. Now, welcome to the last and final thing. Then, sir, what about this part here, this ligament here? This is nothing but the lesser omentum, guys. This will be lesser omentum. Now, why are we not attaching that lesser omentum with the liver? That's the important question here. So, lesser omentum, whenever we have seen in the picture, in the atlas images, we have seen that lesser omentum is the one which is between the stomach and the liver. But in this diagram, sir, why are you not actually attaching that one? I'll tell you the reason why. Why? Because to understand that, we have to actually draw one more diagram here. For example, if this one is the esophagus here, then the greater curvature of the stomach, this will be the lesser curvature of the stomach here. And then you just imagine this will be the liver here, guys. Something like this. And between the liver and the stomach, you'll be actually having a omentum here. That's the lesser omentum. That's the lesser omentum. But remember, this lesser omentum actually has got like two parts. One is the attached part and another one is the free margin or the free end. Let me just make it like more thicker here. This is the free end of the lesser omentum. This is the free margin of the lesser omentum. That is the free margin of the lesser omentum. And at other places, you can clearly see it is actually attached. Now, it's all about the taking the transverse section at which level. We have to understand we are taking the transverse section at which level here. Suppose if I take a transverse section at this level. Yes, on one side, I am able to observe the liver there. On the other side, I am having stomach. And between the liver and the stomach, there will be omentum and omentum will be actually attached. But I am not taking the section at this level. No. We are actually taking the transverse section at this level, a little bit below here. Yes. Now, on one side, we are able to see the liver, on the other side, stomach and the lesser omentum, but we can clearly appreciate there the lesser omentum is not attached. There is a free margin of the lesser omentum. That is what I'm trying to make you understand. This transverse section that we have taken here, it's at a level below, or I'll just give the numbers here. For example, this is like number 1 and number 2. Yes, we are taking the transverse section at the level of number 2. So we do have stomach, we do have liver, but no, they're not attached with the lesser omentum in the middle. Why? Because it is a free margin of lesser omentum. Perfectly done. Now, what do you have inside this lesser omentum? In the free margin, I hope everybody knows that it will consist of that portal triad. The portal vein will be there, the hepatic artery and the bile duct. So let us just write down here below. Let us see what will be the content of lesser omentum right now. We can actually divide the lesser omentum into two parts. One will be the free margin of the lesser omentum and another one will be the attached part. Now, what do you have in the free margin of lesser omentum? Free margin of lesser omentum, almost every student knows that it will consist of the portal triad. The portal vein, which is supplying the blood to the liver. Number 2, the proper hepatic artery, which is also supplying the blood to the liver. And number 3 will be the bile duct. So the portal vein, the proper hepatic artery and bile duct, all the three of them are present in the free margin of the lesser omentum. Whereas what do you have in the attached part? Come on, again, same thing. Recall the stomach topic. That's the reason why, guys, almost every time I'm telling you, follow all these topics in the same sequence when I'm teaching. Don't randomly study the different topics. Why? Because everything has got something to be carried on to the next topic also. So when we studied about the stomach topic, recall in the stomach topic, we have learned that in the lesser omentum, that is towards the lesser curvature, there we actually have two arteries, that is the right and left gastric arteries. Right and left gastric arteries. And those two arteries are the content of lesser omentum only, and that too, it is the content of attached part. So let us see in the attached part here, what is the content? It will be the right gastric artery and even the left gastric artery. So that is about the content of lesser omentum. So lesser omentum basically will consist of all these structures: right and left gastric artery, portal vein, proper hepatic artery, and bile duct. And to be very specific, very clear, you have to even learn about the free margin and the attached margin, or the attached part of the lesser omentum. Perfect. So by this, what we have done here, in the transverse section of the abdomen, I told you about the peritoneum and various peritoneal folds and various ligaments and their contents, comfortably without any burden in your minds. Now let us go further more in depth of this topic, and let us concentrate into some other part right now. So from that time, we have been concentrating about the peritoneum and their folds. Now, my dear friends, please shift your concentration into this space over here. So on the either side, you are able to appreciate some space here. So in the embryo, we'll be actually calling it as a coelom, the cavity there. Now after rotation, what is going to happen to this one? So before rotation, I'm able to see it's almost the same on either side. Now after the foregut rotate 90 degrees in clockwise direction, then what will happen? Now after rotation, my dear friends, the diagram is something like this, and I'm able to appreciate that the space is not the same or equal on both the sides. There will be a little bit space present behind the stomach here, and this space which is present behind the stomach is referred to as the lesser sac. That is known as the lesser sac. Whereas all the remaining space in the front will be referred to as the greater sac, guys. That's the concept here. So that's the reason why I told you start from the embryology part and learn this. It will become damn easy. So from that time, we have been concentrating on the liver, the stomach, the spleen, rotation, and all the ligaments, falciform ligament, lesser omentum, and their contents and everything. Now please shift your concentration to the space on either side. Now after rotation, what is going to happen? Behind the stomach, you'll be actually having a little bit space there. That is referred to as lesser sac, and the remaining space in the front will be actually known as the greater sac. So let us first of all write down the names here. So basically, I'm speaking about this one here. This space is referred to as greater sac, and this space here is referred to as the lesser sac. Lesser sac. Perfect. But remember, they are not like completely separated apart. Greater sac and lesser sac are not completely separated apart. They are actually having a connection between them. They are actually connected with each other, and they are connected with the help of a foramen, and that foramen is referred to as epiploic foramen. Now what I have observed during the live classes, most of the students are thinking that this opening here is referred to as epiploic foramen. Absolutely wrong. Blunder. It's a big mistake. That is not epiploic foramen. Where do you exactly have the epiploic foramen? It is actually behind the lesser omentum. It is not on the side of the lesser omentum, it is actually behind the lesser omentum, and this foramen is actually referred to as epiploic foramen of Winslow, which is also known as omental foramen, guys. Epiploic foramen. So now, after drawing all this diagram here, or let me just write down here, what is the name of this foramen here? This is epiploic foramen. Now after making you understand this entire concept crystal clearly with the help of our diagrams here, let us now compare this with the atlas diagram here, guys. Now try to correlate our diagram with this atlas diagram over here. So after rotation, yes, I'm able to appreciate this is the liver over here. Liver will come towards the right, and this will be the spleen here. Perfect. And this is the stomach over here, guys. Now, what is that ligament that you're able to appreciate here between the spleen and the posterior abdominal wall? So this ligament here will be the splenorenal ligament. This is splenorenal ligament. Already we have written all the notes in detail there. It doesn't make any sense writing it again here. So let me just tell you, and you will keep on comparing with our diagram that we have drawn. So splenorenal ligament or lenorenal ligament will have splenic artery along with the tail of the pancreas. Now this ligament between the stomach and the spleen, gastrosplenic ligament, and that will consist of the arteries which are present towards the greater curvature of the stomach, that is gastroepiploic artery along with the short gastric artery. And then in front of the liver and the anterior abdominal wall, you are able to appreciate one more ligament there, that is falciform ligament, which contains ligamentum teres. And yes, this of course is the lesser omentum. This is nothing but the lesser omentum here. And you can clearly appreciate this diagram is again taken at that section which I have numbered there as number 2. So that section a little bit lower, and that is the reason why we can appreciate it is not attached to the liver there, guys. Perfect. Now the last and final thing, yes, the main important thing that I actually wanted to insist upon after rotation is, yes, we are left out with a little bit of space behind the stomach. And this space which is present behind the stomach over here is referred to as your lesser sac, and the remaining everything will be the greater sac. So remaining space over here will be the greater sac here, and this will be the lesser sac. And still you're able to appreciate that there is one opening here which is connecting the greater sac with the lesser sac, and this opening is referred to as foramen of Winslow. Now we got to learn what are the relations of this one, the anterior, posterior, superior and inferior. And if you are properly following me from the very beginning of this topic here, now these relations will become easy for us. Observe this. Let me just zoom in. Observe this epiploic foramen there. What do you have right in front of the epiploic foramen? Right in front of the epiploic foramen, you are able to appreciate that free margin of lesser omentum. And what do you have inside that free margin of lesser omentum? Portal triad. So yes, we are able to see the portal vein here. Immediately in front of the epiploic foramen, right in front of the epiploic foramen will be portal vein. And in front of that, anterior to that and right will be the bile duct here. And towards the left will be the hepatic artery here. You need to even learn their arrangement also. So what you have immediately in front of the epiploic foramen will be the portal vein, and in front of that, anterior to that and towards the right, bile duct, anterior to that and towards the left will be the hepatic artery. That is about the anterior relation. What about the posterior? Immediately behind the epiploic foramen, you are able to appreciate inferior vena cava. And not only inferior vena cava, suprarenal gland. And of course, which one? Towards the right. Liver, behind the liver, towards the right. It is right suprarenal gland, and even the body of T12 vertebra. So the body of T12 vertebra, the suprarenal gland and inferior vena cava are the posterior relations of epiploic foramen. So that is about the anterior relation and the posterior relation, guys. Now once you are comfortable with this one, superior and inferior will be damn easier. How? Let me first of all show you all the relations here in the pictures, and then afterwards we'll actually draw our diagram. Now my dear friends, look at this diagram here. Now in this diagram, try to understand where do we have the epiploic foramen. I told you very clearly, epiploic foramen is not towards the right, which is the most common mistake made by many students. It is towards the right side of the lesser omentum. No, it's actually behind the lesser omentum. So epiploic foramen is not in the front here, it's actually behind here. It's behind the free margin of the lesser omentum. So if it is behind the free margin of lesser omentum, try to understand in 3D. What do you have like above that? Above that, I'm able to see liver. Which lobe of the liver is important? That is caudate lobe of the liver. Caudate lobe of the liver. And below, you're able to appreciate the first part of duodenum. So this is D1. I'm just writing a D1. First part of duodenum. And above, you'll be actually having liver and of course the caudate lobe of the liver, not quadrate, caudate lobe of the liver. Superior, inferior. And in the previous diagram, we have actually done with the anterior and the posterior relations of epiploic foramen. Now let us just write down and finish it off. So I'm not going to draw the entire diagram again, guys. It becomes like very much cluttered if you draw this entire diagram. Let us just focus only on the epiploic foramen. So I'm going to draw the diagram of only and only the epiploic foramen. First, learn the another name of that. Epiploic foramen, remember, it is also known as the foramen of Winslow. Foramen of Winslow. One more name, it is also known as the omental foramen. omental foramen. Now here I want you all to be like very much careful. Why? Because lesser sac is the one which is referred to as omental bursa. So don't try to get confused between these two. Lesser sac is omental bursa, and of course this one is a foramen opening. So this is nothing but omental foramen, guys. So epiploic foramen or foramen of Winslow or omental foramen. Let us see what are the boundaries of this one now. So imagine this one to be the lesser omentum, and this is the free margin of the lesser omentum over here. I'm using the same color, guys. So lesser omentum, and imagine there is a free margin of lesser omentum there. And here we actually have the foramen, that is foramen of Winslow, epiploic foramen. And what do you have like right behind the epiploic foramen? There will be vena cava, inferior vena cava. And just behind that, you'll be able to find the adrenal gland or suprarenal gland, the right suprarenal gland. And then you'll also be able to appreciate the T12, the body of 12th thoracic vertebra. The body of 12th thoracic vertebra. So whatever structures that we have drawn here, all these structures are nothing but the posterior relations of epiploic foramen. That is about the posterior relations of epiploic foramen. Inferior vena cava, the vertebral body of T12 and right suprarenal gland. Then what do you have anteriorly? Anterior to the epiploic foramen, there will be a portal vein here. This is portal vein here, immediately in front of the epiploic foramen. And anterior to that and towards right, there will be bile duct. And anterior to that towards the left, there will be a proper hepatic artery. There will be proper hepatic artery. So basically the portal triad will be present in the free margin of lesser omentum, but you also have to remember the exact arrangement of that one. And all this will be actually the anterior relations of epiploic foramen. So these are the anterior relations of epiploic foramen here, guys. Now I'll tell you one simple logic here, or we can say a simple mnemonic here to remember this one. Out of that three, that is in the three things in the portal triad, remember P for portal vein and P for posterior. I'm not telling about the posterior to epiploic foramen, don't get confused here. I'm only telling about those three structures in the portal triad. So out of that portal vein, bile duct and hepatic artery, portal vein, P for portal vein, P for posterior, it is present posteriorly. And right in front of that and towards the right, it will be bile duct. Bile duct. One way to remember, one simple and a formal way to remember, it is a duct, and duct, D for duct and D for dextrose. So levo, dextro, right and towards the left. So dextro is nothing but towards the right. Okay, levo towards the left. So dextro, duct, you can remember towards the right. And another like informal way of remembering, somewhere in the book I have read that bile duct, B for bile duct and B for BV. And you all know BV, wife is always right. So bile duct, B for bile duct and B for BV towards the right. And what is the only thing left out? That is hepatic artery, and artery towards the left there, anterior towards the left, guys. So P for posterior, P for portal vein, and B for bile duct and BV towards the right. And then the only thing left out is proper hepatic artery. Artery will be towards the left side. Perfectly done. That is about the anterior and posterior relations of epiploic foramen. And what about the superior inferior? We don't have to draw the diagram again, guys. You just mention there, you just write down there. Superiorly, what do you have? You have liver, and exactly which lobe of the liver? That is caudate lobe of the liver. You have to be like very careful. It has been given many times in the exams, and in exam they have always tried to confuse the student by giving caudate lobe. It's not caudate, it's actually caudate lobe of the liver. Then what do you have inferiorly? Inferiorly, you actually have the first part of duodenum. Below the epiploic foramen, you have got first part of duodenum. And by this, it makes all the boundaries of epiploic foramen damn easy, guys, extremely easy. All the boundaries of epiploic foramen have become very much easier. Anterior, posterior, superior, inferior, without mugging. No need to mug up. Try to understand very conceptually. Now, in this diagram, we have seen the transverse section of the peritoneum, guys. We have actually seen the entire peritoneum in the transverse section, how the structures are arranged very conceptually starting from the embryology part. We have seen that. And now let us see the sagittal section, how all these structures are arranged in sagittal section. And that too, we are also going to see about the peritoneal folds, how the peritoneum will be present, and in that we'll also appreciate the lesser omentum, the greater omentum, and even the transverse mesocolon and mesentery and everything in the sagittal section. So that completes the entire concept of transverse section, and now let us see the same thing in the sagittal section. Now my dear friends, basically I am going to take a section from here at this level, but you won't be able to understand the orientation more clearly in this way. Let us show it on our body here. I'm actually taking a sagittal section here. I'm cutting my body exactly from here, not exactly from the middle, okay? So a little bit towards here, like this. Now once you take a sagittal section here, try to first of all make up in your mind what is present above here. Yes, liver. So I'll be able to first appreciate the liver. And just below the liver, there will be actually a stomach present here. Like you'll be having all that fundus, body and pylorus part of the stomach. So then you'll be able to appreciate the stomach below that. So liver first, then below that stomach. And then further if you take a section, there will be a colon, transverse colon. And then further if you take the section here you'll be actually having all those coils of jejunum and ileum. I mean to say the small intestine, coils present there. So let us now cut in this manner. So first I'll be getting liver, transverse colon, and then below that you'll be able to appreciate the coils of small intestine. So let's cut here, remove one of the part and then see the other part from a side. So let's see the another part from a side in sagittal section now. So don't be in a very hurry here guys. Comfortably, calmly, coolly. First try to understand here. This is your liver here. Just below the liver, this is the stomach here. And we know very well between the liver and the stomach there will be omentum. That omentum is lesser omentum. And then this here will be the colon, that is transverse colon. And then finally my dear friends, this will be actually the coils of small intestine here. So I'm just writing as SI, small intestine, that ileum, jejunum and all. So let us actually draw this diagram and the things will become much more easier. And later on we'll again come back to this atlas image here. So basically I want you to understand the section is at which level and which structures you'll be able to appreciate. So transverse section has been done, and now let us see the sagittal section to understand further details about the lesser sac and the greater sac. Now for example, if this is the sagittal section here of the abdomen, and I'm going a little bit below up to pelvis also. And in this sagittal section, for example, here you have your liver, and just below the liver you'll be able to appreciate the stomach here. So liver, below the liver, stomach, and then you'll be able to appreciate the transverse colon, and then there will be like so many coils of intestine here, small intestine. And later on a little bit below from the abdomen, I'm actually going into the pelvis part also right now. Now in the pelvis part you'll be actually able to appreciate there will be urinary bladder here. Just behind the urinary bladder here, imagine this part here to be the uterus and the vagina part, and then later on here will be the rectum. There guys. So this is the sagittal section, and now let's trace the peritoneum. Now it's about the peritoneum. Let's trace that right now. So starting from here, first of all the peritoneum covering the liver, and from the liver to the stomach and enclosing the stomach. Then from the stomach, my dear friends, remember you actually have that omentum moving down and then coming back here to the transverse colon, and then reflecting from here and going to the posterior abdominal wall. Then further traveling along the posterior abdominal wall as parietal peritoneum, and then it is coming here and enclosing the small intestine, all the coils of small intestine, and again going back. And you are able to appreciate that double layer of peritoneum formed there. And that double layer of the peritoneum, which will be connecting the small intestine to the posterior abdominal wall. That double layer of peritoneum, which is connecting the small intestine to the posterior abdominal wall, that double layer of peritoneum is actually referred to as mesentery. That's all. So unnecessary, the students will be actually confused, okay, what is mesentery and all. Mesentery is nothing but peritoneum only. That is double layer of peritoneum which is connecting the small intestine to the posterior abdominal wall, holding it. Let us further trace this peritoneum here, guys, going down into the pelvis, rectum, and then it will be taking, or it will be reflecting from here, then the uterus, and then it will be again reflecting from here. There will be formation of the pouches there, don't worry, I'll tell you about that. And finally, this is the parietal peritoneum just connected here. Perfect. Then what about the posterior aspect, sir? Then again, on the posterior aspect also, you'll be actually having the peritoneum here. Let us just quickly trace this one, enclosing the liver. Wow. You're able to see that there is a double layer of peritoneum between the liver and the stomach there. That name has been given as lesser omentum. And from here, enclosing the stomach, this will be going down and again reflecting back here, enclosing the transverse colon here, guys. Then going back to the posterior abdominal wall. Again, the same thing, you're able to appreciate here, a double layer of peritoneum connecting the transverse colon to the posterior abdominal wall, and this time the name changes. It's mesocolon. That is again the double layer of peritoneum only, mesentery only, but it is enclosing what? It is enclosing colon. That is the reason why it is known as mesocolon, and that too transverse colon. That is why transverse mesocolon. That's all. So it's looking like a lot of terminology here: omentum, mesentery, mesocolon. So much of terminology here, but ultimately it's all peritoneum, and that too double layer of peritoneum. And finally, just to finish off this one here, guys, this is the parietal peritoneum in the posterior abdominal wall here, connected finally. That's your entire sagittal section. And we have traced the peritoneum perfectly. Now in this, try to again recall the same concept here. Where do you exactly have the greater sac and the lesser sac? We have actually seen in the transverse section. Lesser sac will be present behind the stomach. That small space behind the stomach will be lesser sac. If you just want to see that, I can show you in our diagram here. Yes, you can clearly appreciate here. Lesser sac, that yellow colored one which I have highlighted below, behind the stomach, will be nothing but your lesser sac only. So let us try to appreciate that in the sagittal section also here. Yes, guys, this entire space over here will be the lesser sac. So this entire space over here will be the lesser sac here, guys. So that's the lesser sac, and in front of that it will be greater sac. So let us just write down the name here. What is the another name of the lesser sac, guys? I just now told you it is omental bursa. Lesser sac is also referred to as omental bursa, and this one here will be the greater sac. Greater sac. Perfect. Then apart from this, what about this omentum here between the liver and the stomach? This omentum will be the lesser omentum. And this one here, this entire thing here will be the greater omentum. Now try to understand here, this is something very important which we are actually studying for the very first time here. Greater omentum is the one which will be actually having 4 layers. There will be 4 layers in the greater omentum. So the 2 layers starting from your stomach, going down, and then taking a turn, coming back and getting attached to the transverse colon. So it will be actually having the 4 layers. And then finally, I told you already about this one here. This will be actually the mesocolon, that is transverse mesocolon. And this here will be the one which is mesentery. The double layer of peritoneum which is connecting to the small intestine will be the mesentery. Now let us see one more concept from the pelvic region here itself, guys. What about these pouches that you are able to appreciate here below? I am able to appreciate one pouch between the rectum and the uterus here, this one. We are able to appreciate one more pouch here between the rectum and the uterus over here, guys. Sorry, the urinary bladder and the uterus here. Now what will be the name of this pouch between the rectum and the uterus? That is a recto-uterine pouch. A recto-uterine pouch. Recto-uterine pouch, which is also referred to as pouch of Douglas. And this recto-uterine pouch is the most dependent. It is the most dependent site in standing position, guys. In erect position or in the standing position. Okay. So recto-uterine pouch is the most dependent site in the standing position. That's very much important. And apart from that, between the urinary bladder and the uterus, this pouch here It's actually nothing but your vesico-uterine pouch. Urinary bladder, vesicle, vesico-uterine pouch. So it is vesico-uterine pouch here. So because we are actually learning about the peritoneum, it's very perfect and it is very conceptual to even learn about those reflections over there in the pouches, so that it will be done here itself. You don't have to learn it separately, and most of the students are unable to connect that. So now I think the things are very much easier now. Now one last and final thing to be studied in this one will be about the lesser sac relations of this one. Now what will be the relations of lesser sac anteriorly and posteriorly, guys? I think I don't even have to teach you here. You're clearly able to appreciate in front of the lesser sac. Are you all able to appreciate the liver? You just have to add there, it is which lobe of the liver? Caudate lobe of the liver, anteriorly. And then omentum here. Yes, that is the lesser omentum. And then the stomach, of course, the posterior surface of the stomach. And then that is greater omentum, but which layers? Only the first two layers of the greater omentum, first and second layer. That is all the anterior relations of the stomach. Anterior relations of the lesser sac. I repeat again. So what are all the anterior relations of lesser sac, guys? Number one, you'll be actually having the liver there, and then lesser omentum, and then the stomach, and then the greater omentum. Only the first two layers, first and second layer. Posterior relations of the lesser sac, you don't have to worry about that. Why? Because it will be all the stomach bed relation, behind the stomach, all the stomach bed relation. And I hope you remember the mnemonic that I gave you. Dr. SSS killed patient mercilessly. Dr. SSS killed patient mercilessly. So that is the thing that makes the thing simple here. That is the reason follow all my videos in the same order. Okay. So let us now just write down the relations of lesser sac. So relations of lesser sac. First, let's see what will be the anterior relations of the lesser sac. Anteriorly, you will be first of all having liver, but be very careful, it is the caudate lobe of the liver. Below that, you will be able to appreciate the omentum, and that omentum is lesser omentum. And below that, you will be able to appreciate the stomach, but which surface of the stomach? Of course, the posterior surface of the stomach. And then the first and second layer of greater omentum. First and second layer of greater omentum. Perfect. And these are actually the anterior relations of lesser sac. Anterior relations of the lesser sac, guys. Then what about the posterior surface relations or posterior relations of lesser sac? And as I told you, posterior relations of lesser sac, you don't even have to learn it separately now. If you people have learned the stomach topic along with me, the stomach bed relation. So all the stomach bed relation, I'll just write down the hint here. All the stomach bed relations except what, sir? Except spleen. Please make a note of that very clearly. Spleen will not be included here in the posterior relations of lesser sac, except spleen. So let us just revise that once, guys. It will be like a revision, and even this lesser sac relations will also be done. Come on. Dr. SSS killed patient mercilessly. Dr. D stands for what? Dr. D stands for diaphragm. And of course, it will be the left crus of diaphragm. We are speaking about the stomach bed relation. Behind the stomach, it will be the left crus. And after that, S for splenic artery. And then SSS, one more S here. One more S here stands for the left suprarenal gland. And of course, the suprarenal gland is present over the kidney only. So even the left kidney should also be present there. Now, along with that, one more S will be the splenic flexure of colon. Splenic flexure of colon. And then patient P stands for pancreas. Even you also have the pancreas there. And of course, the mesocolon. Transverse mesocolon. So guys, all these things already we have learned in the stomach topic itself. So that is how I'm trying to make the things concise and easy for you in a sequential order. So all the stomach bed relation except the spleen will also be the relations of lesser sac only. So you don't have to learn it two times separately. Only one thing that you have to add here, even the third and fourth layer of greater omentum. So guys, that is about the posterior relations of lesser sac. So you just have to make it very simple, that is about the stomach bed relations. Along with it, you just add the third and fourth layer of the greater omentum. So that makes the things easier to learn about the relations of lesser sac and even the sagittal section of this entire peritoneum here. Made easy. So guys, that is about the posterior relations of lesser sac. So you just have to make it very simple, that is about the stomach bed relations. Along with it, you just add the third and fourth layer of the greater omentum. So that makes the things easier to learn about the relations of lesser sac and even the sagittal section of this entire peritoneum here. Made easy. Now one last and final point that I want to add here is that rectouterine pouch. Rectouterine pouch, I told you it is also known as the pouch of Douglas. I'll just write it here guys, pouch. So yet rectouterine pouch, it is also known as the pouch of Douglas. And I told you it is the most dependent site in the erect position, I mean to say standing position. Then obviously I get a doubt in my mind. Sir, what about the supine position then? In the supine position, then what will be the most dependent site? Now below the liver towards the right side below the liver, there will be a space there, and that is the reason why it is known as the subhepatic space, right subhepatic space. And below the liver, you also have your kidney over there, right kidney. That is the reason why it is also known as the hepatorenal pouch of Morrison. And that is the most dependent site in the supine position. So let us just try to make a note of this one here itself. So just below the liver towards the right side, right subhepatic space here, and which is also known as the hepatorenal pouch of Morrison. And this one will be the most dependent site in supine position. Perfect. So subhepatic space, actually, that is between the liver and the kidney over here guys, that is hepatorenal pouch of Morrison. That is the most dependent site in supine position, whereas rectouterine pouch of Douglas, it is actually the most dependent site in the erect or standing position guys. Okay, so that's all about the peritoneum here. So I request all of you to please learn it in the same order, starting from the embryology part, development of the liver and the spleen in the ventral mesogastrium and dorsal mesogastrium, then the rotation of the foregut 90 degrees clockwise, then it will lead to the formation of the lesser sac and the greater sac, in fact connected by epiploic foramen. Then you learn the relations of the epiploic foramen, and then after the transverse section, learn the sagittal section. The things are going to become much more easier guys. I hope the peritoneum topic is now crystal clear, no more doubts in your mind. Thank you. That's all. Just now we have discussed entirely about the peritoneum and the peritoneal folds in a crystal clear manner. It is the same peritoneum, okay, and it is given like different names at different location. For example, the double layer of peritoneum between the liver and the stomach, omentum, lesser omentum. The double layer of peritoneum between the stomach and the transverse colon, greater omentum. Double layer of peritoneum again between the posterior abdominal wall and transverse colon, transverse mesocolon. Similarly, the double layer of peritoneum between the posterior abdominal wall and small intestine, mesentery. So what I'm trying to put in your mind is that don't get confused with all this different terminology like omentum, mesocolon, mesentery and all. So that is very much easier. And now what I'm trying to teach you here is about the root of the mesentery. Root. Now basically what is the meaning of root? See, there should be one location where what is going to happen? The peritoneum is reflecting, then going and enclosing that particular organ, and then again coming back here, and we are having a double layer of peritoneum. For example, you imagine my hand here to the transverse colon. If this is transverse colon here, from the posterior abdominal wall, first the peritoneum will come here, enclose that, and again the peritoneum will actually go back. So I'm having a double layer of peritoneum here. And then if you observe the posterior abdominal wall, there the peritoneum is actually reflecting. It is reflecting and again coming back and touching. And that part from where it is reflecting is referred to as root. That is actually known as a root. So let me show you here in this diagram, if you are able to appreciate here, this one will be actually the root of the transverse mesocolon. So we have actually removed the transverse colon from there, and that is the root. That is a part from where the peritoneum is actually reflected. Now similarly, we are able to appreciate here, this is the root. So similarly, you are actually able to appreciate even the reflection of the peritoneum for the small intestine also. So here you are able to see the small intestine has been removed here, and this is the reflected part of the peritoneum, and this is the one which is actually referred to as the root, and this is the root of mesentery. Mesentery is the one which is going to hold what? It is the one which is holding small intestine. So that is the root of mesentery. Now what you have to learn here, it is starting from where? It is starting from the duodenojejunal junction. So there will be duodenum and jejunum there, duodenojejunal junction, DJ junction, and it is extending all the way up to the right sacroiliac joint here. So this part is corresponding to the right sacroiliac joint. Now, after learning about the extent of that entire root of the mesentery, you should also learn it is going to cross which all structures one by one. So you can clearly see that root is actually crossing the third part of the duodenum here. Then you are able to appreciate the aorta here, abdominal aorta, and this is the inferior vena cava here. And the most important thing about this muscle here will be the psoas major muscle, of course, towards the right side. And along with that, that is the ureter. The right ureter in the front of that one, guys. So better we'll draw our diagram here and try to understand about the root of mesentery and all the MCQs which will be asked there. So root of mesentery. Now what is this root of mesentery actually holding, guys? It holds the small intestine, all the coils of small intestine. Or else we can also call it as like it is holding midgut basically. Basically it is holding what's the midgut wala part, small intestine. For example, if this one here is your first part of the duodenum, the second part and the third part of the duodenum and fourth part. And the fourth part of the duodenum will be actually continuing into jejunum there, duodenojejunal junction. And right at this place, you'll be actually having the peritoneum reflecting, and that is what is referred to as the root of the mesentery. So first you got to learn the root of the mesentery is extending from where to where? It will be extending from the DJ junction, that is duodenojejunal junction, up to the right sacroiliac joint. Right sacroiliac joint. That is the extent first of all. First of all, you got to learn about the extent. Then secondly, you have to learn like what are all the structures which are being crossed by the root of this mesentery. So third part of duodenum you are able to appreciate there. Not only that, even the aorta here. And then just adjacent to that one, you'll be actually having the inferior vena cava. Inferior vena cava over here. And then there will be that muscle, psoas major muscle is also crossed by that. And just lying over that psoas major muscle, you also have the ureter. And of course, I don't have to tell it again and again repeatedly the right. It will be right ureter, it will be right psoas major, everything towards the right side. It's actually the root of mesentery going towards the right. So let us just write down all these things and finish off this part, guys. So root of mesentery will be first of all crossing the third part of duodenum. And then it is also crossing the aorta. And then it is also crossing the inferior vena cava. And then of course the right ureter, the right psoas major. And then, yes, I'm not drawing here, try to just add there as right gonadal veins also. Gonadal vessels. The diagram will become like more complicated if you draw that, but just try to imagine you even have the right gonadal vessels over there. So all these are the structures which are actually crossed by the root of the mesentery. So root of mesentery crosses, I repeat again, third part of the duodenum, the aorta, inferior vena cava, right ureter, right psoas major and right gonadal vessels. One last and final thing, what do you have inside that? We are done with the extent. Extent is done. We are done with the structures crossed by that. Done. Now what is the last and final thing to learn? The contents. I'll tell you one simple logic, guys, how to remember this one. Don't try to mug up this one also. Mesentery is going to hold what? Mesentery is the one which is holding the small intestine, the coils of jejunum and ileum. And the coils of jejunum and ileum, they are actually belonging to which gut only? Midgut. And midgut is the one which is supplied by superior mesenteric artery and drained by superior mesenteric vein. And this mesentery is the one which is allowing those vessels to pass through and go and supply to the small intestine. So what is the content of that? It will of course consist of superior mesenteric artery and superior mesenteric vein. It's so easy to remember that one. Mesentery, the name itself is telling you, it is the one holding the small intestine. Small intestine belongs to the midgut part. Midgut will be supplied by superior mesenteric artery and drained by superior mesenteric vein. So that should be the content of that. So we are done with everything related to the root of mesentery, the extent of that, the structures crossed by that, as well as the content of that. And that completes everything regarding the peritoneum, including the roots here, guys. That's all. Thank you.